Welcome, everyone. Thank you so much for joining me. My name is Dr. Laura Von Hagen, and I am a naturopathic doctor with a focus on PCOS. Today, I'm going to be discussing a natural approach to PCOS, so how we can help you manage your symptoms better. Lovely that you're going to be here with us today, so let's get started. So just a little bit about me. So as I said, my name is Dr. Laura Von Hagen. I have an undergrad in kinesiology as well as a master's in anatomy, and then a doctor of naturopathy from the Canadian College of Naturopathic Medicine. So I'm a registered naturopathic doctor here in Ontario, Canada. I'm also an author. I wrote my book, My PCOS Pregnancy, which is your guide to getting and staying pregnant with PCOS. I have a strong clinical focus on fertility, and I'm also an IVF mom of two boys. So I've been through this journey myself as someone who has PCOS and struggled to conceive. I've been able to have my own journey and want to share with others how I can best help you. So just a little joke to get started today. I'm so classy, even my ovaries wear a string of pearls. And if you're not familiar with what this might mean, you should by the end and understand how we diagnose PCOS. So for today, I just want to cover our learning objectives together. We want to define PCOS. So what causes PCOS and what is and is not PCOS? Blood work and assessment that we might consider for you. The optimal PCOS diet, because there's so much misinformation out there. And I know a lot of you are struggling with what to eat, or maybe you're feeling overwhelmed with what you're reading online or really restrictive diets. And I want to bring some more abundance back into your diet and make you feel good about your healthy food choices. We're going to talk about how to exercise for better PCOS management, along with naturopathic care for enhancing your fertility. So, what naturopathic doctors can do to help support you, especially if you're trying to conceive. And then, if you have any questions after reading this, you can always reach out. So it's just an overview. After today's presentation, these are my goals for you listening in. I want you to be able to recognize if you have PCOS. So to go, this sounds a lot like me. Gain clarity around the options for managing your PCOS. I want you to feel hopeful about your diagnosis, especially when it comes to your fertility journey. Maybe you've recently been diagnosed with PCOS and you're feeling really nervous about trying to get pregnant, or if you're going to struggle. I want to bring some hope back in and some clarity around what this means for you. I want you to have increased confidence when discussing PCOS with your provider. So, when you are working with your medical provider, what questions should you be asking about your PCOS and what are your treatment options? So, why you're here, why are you listening in to this webinar? You are someone who makes informed decisions about your health. You want to take charge. You want to feel empowered. You're confident in other parts of your life, and now you want to feel confident in your health, and we're going to help you. You are your best advocate. You know what you want to ask for and how to better support yourself. You value evidence based information. We really want to stick to the research today and help support you. And you believe that you don't have to struggle with your PCOS. We want to make this seem easier. Just as a reminder, today's presentation is really for educational purposes and not intended to treat or diagnose. This is not medical advice, and things I'm saying here might be right for you, or maybe they aren't, right? This information is not for everyone. So it's for an educational purposes, and I truly believe that knowledge is power. And then with this knowledge, you can use that power to feel better informed about what is the best decision for you. So, what is PCOS? PCOS stands for polycystic ovarian syndrome. And it's the most common endocrine disorder, meaning it affects our hormones, and it's also the most common cause of infertility. We think it affects about 5 to 10% of women of childbearing age, although this might vary a little bit depending on the study. I've seen some say 5%, some say up to 15%, but somewhere around that 10% of women will have PCOS. PCOS is not just a fertility issue. There are reproductive, metabolic, and cardiovascular consequences. So it's not just about getting pregnant, but it's about your long-term health as well. And PCOS is highly genetic. Your diet is not the cause. So eating donuts did not give you PCOS, right? Although we can use diet to help treat PCOS, you probably have PCOS because of a genetic underlying condition and not something you did to cause it. So what do we know then about what causes PCOS? Well, insulin resistance is believed to be the main cause of PCOS. So, what happens is when we have these high levels of insulin, which is a hormone in our body, this increases things called androgens, which are male type hormones, to be produced in the ovaries. Normally, our ovaries secrete estrogen, and that estrogen helps grow those follicles to release the egg, which happens to then cause ovulation. When we have PCOS, we overproduce this testosterone, which causes an abnormal balance in our hormones, which then leads to irregular periods and what we call anovulation, or cycles where you don't ovulate. We know that there's some genetic alterations to how the body responds to insulin, and also potentially maybe you were exposed to higher levels of androgens when you were in your mother's uterus, and this is what's linked to the development of PCOS. So we have some genetic things and what we call some in uterine exposure. And if there's any of you out there who really love the science and better understanding it, I did include a graphic here on the slide where you can see starting at our hypothalamus or our upstairs hormones up in our brain, we have this normal sort of hormone cascade going down to our ovaries. And this gets disrupted because of this insulin resistance and overproduction of androgens. So, diagnosis and assessment. So, as I mentioned, you're so classy, even your ovaries wear a string of pearls. When we look at someone with PCOS on ultrasound, we look at their ovaries, we see this sort of string of pearl appearance that you can see here in the picture, where there's all these cysts that have formed from those follicles that are trying to ovulate. But because we have this irregular ovulation, they often form these cysts, which now line the peripheral of our ovaries, hence PCOS. So we're going to see what we call oligo or amenorrhea, so few or no periods, polycystic ovaries, so the presence of 20 or more follicles total, and an increased ovarian volume, so the ovaries are going to be enlarged. We're going to see clinical and biochemical evidence of excessive androgens. So this could be things like high testosterone on blood work or cystic acne. And although it's not diagnostic, a high AMH, so an ovarian reserve, increases the suspicion of PCOS. And this level depends on which units you're looking at and which study. So there's no perfect cutoff to say if your AMH is this, you have PCOS. Keep in mind with the Rotterdam criteria, you only have to have two of the three. So either oligo or amenorrhea, polycystic ovaries, and clinical and biochemical evidence of excessive androgens. So for some people, they have what type of PCOS phenotype, where they might just have few periods and polycystic ovaries, but they don't actually have any acne. So that because it's a syndrome, everyone's going to present a little bit differently. So just because your friend has PCOS and has cystic acne doesn't mean you have to have cystic acne in order to be diagnosed with PCOS. So, when it comes to diagnosis and assessment, what are the most common symptoms of PCOS? So, about 90% of individuals experience something called hirsutism, which is like excessive facial hair. So, I often hear from my patients with PCOS, I have to shave my beard every day, or I just have so much chin hair, I have to go for laser. Menstrual irregularities with anovulation. So instead of getting your period maybe every 28 days, someone might get their period every 40 to 50 days. Infertility and increased risk of miscarriage. So, about 75% of individuals with PCOS struggle to get pregnant. We also see higher rates of miscarriage with PCOS because of that insulin resistance. So, it's not only about getting pregnant, but it's also about staying pregnant and helping manage your blood sugar. There's actually some really cool studies going on right now with a certain form of a B-like vitamin, something called inositol, which I'm going to mention later, looking at how we can use inositol to reduce some of these risk factors in pregnancy. And so that can be something that we can look at for yourself and to speak to your healthcare provider about is using certain supplements to help manage your risk if you're pregnant with PCOS. Other symptoms might include things like cystic acne, rapid weight gain, binge eating disorder, anxiety and depression, blood sugar dysregulation, sugar cravings, and fatigue. So, not only is it the physical symptoms, but the mental symptoms as well. And the newer criteria for PCOS really emphasizes this mental emotional component because we see these higher rates of anxiety and depression in patients with PCOS. We have to make sure we treat the body as a whole. Well, how do I know if it's something else, right? Because maybe it's PCOS, Maybe it's actually a thyroid dysfunction. Maybe that weight gain is being caused by hypothyroidism and an underactive thyroid. Keep in mind, too, that it's possible to have a thyroid disorder and PCOS. So, this is why it's really important to get a proper diagnosis and assessment. And in certain cases, run blood work and ultrasound if necessary to make sure we're treating the right thing. Could be Hashimoto's, which is the autoimmune form of hypothyroidism. And we know that people with Hashimoto's are at higher risk for PCOS and vice versa. Vitamin D deficiency, this is more prevalent in patients with PCOS and can exacerbate symptoms. Metabolic syndrome, burnout, sleep apnea, depression, anxiety, or binge eating disorder. So, as I said, we want to rule out these other causes of your symptoms, but it's entirely possible that you have Hashimoto's and PCOS. This here is some blood work that we might consider running for someone with PCOS. And by no means is this blood work that every single patient with PCOS needs to have. It's just more so of a list that we might look at and consider when we're putting together our case and trying to better diagnose you and make sure that we're accurate with our diagnosis. So if you're speaking to your healthcare provider and saying, I think I have PCOS, can we get some blood work done? Depending on your case, here is some of the blood work that we might advocate for. This could depend on your symptoms that you're having, whether or not you're trying to conceive, how old you are. So these are things that we would keep in mind. And as you can see here, it's not just about testing hormones, but it's also at looking at things like your lipids, your cholesterol, because we know that there's a higher risk of cardiovascular disease with PCOS. So it's beyond just treating the hormones, but looking at all the things related to your PCOS and how we can keep you healthy. Nutrition for PCOS. So, as I said, today I wanted to talk about the optimal diet for PCOS, but I want to come from a place of abundance and helping you feel comfortable adding more food into your diet versus feeling restricted in the things that you have to take away. I see so many myths out there, and patients come in and they're just eating so little food. And I want to take some of that fear out of eating and help you feel really comfortable around your nutrition and your metabolic health. So, what do we know in the literature? Women with PCOS tend to undereat vegetables, fruits, fish, protein rich foods, and healthy fats in their diet, whereas we tend to have a higher consumption of sodium, saturated fat, simple carbohydrates, and processed foods. And this is something that we want to try and shift. So, we want to try and get away from some more of those ultra processed foods, those quick carbohydrates that are high in sodium and unhealthy fats, and reach for a more whole foods diet. When tracking their macronutrient intake, we also see that patients are often protein deficient. And protein is so important for fertility and for PCOS. And we see that when patients with PCOS increase their protein intake, we have better blood sugar management, we have better metabolic health, our testosterone levels go down, and we have better BMI and better body weight management control. So we do want to make sure that we're getting optimal amounts of protein and are really focusing on a whole foods diet. So at this point in time, what is the best diet for someone with PCOS? So the evidence suggests reaching for a higher protein, low glycemic load diet for improving fertility outcomes. So keep in mind here, what I'm not saying is a low carb diet. By no means are we going keto here. Keto or the ketogenic diet is just simply unsustainable for the majority of people to keep to, and it is so highly restrictive. Whereas if we really emphasize eating more protein and choosing the right carbohydrates, that can be a really winning combination for PCOS. And low glycemic tends to be foods that are higher in fiber. So this would be reaching for things like whole grain or rye bread over a white bread, sweet potatoes over a white potato, for instance. So trying to get more of those whole grains in our diet and upping our fiber to carbohydrate ratio is very important. Also interesting is meal timing. So just simply eating a bigger breakfast and a smaller dinner is associated with improved blood work and higher rates of ovulation. So trying to kind of front load our calories earlier in the day. And then trying to minimize our snacking after bedtime for better blood sugar management. So, what are the top foods that I recommend all the time for my patients with PCOS? Reaching for more healthy fats. So, things like our avocados, our nuts and seeds, our wild salmon to get our omega-3s, and extra virgin olive oil. That's the EVOO. Fruits and non-starchy vegetables. My favorite here is berries because they're so high in antioxidants. Lots and lots of quality protein, especially coming from things like fish or seafood. And then, as I said, our complex carbohydrates, so things like oats, quinoa, millet, sweet potatoes, and legumes, which are going to be really high in fiber and having more of those whole grains and less of those processed carbohydrates. When we think about food as medicine, there's a few that really stand out in the studies on PCOS. One is apple cider vinegar, which can be great for blood sugar management and hormones. So you can add this into a homemade salad dressing with your olive oil, and that's a great way to get in more vegetables. Soy. I know what you're thinking. You've probably read that soy is bad with you going, but no, Dr. Laura, I avoid soy. I promise you, soy is actually really beneficial for PCOS, helps improve fertilization rates with IVF. It's also been shown to help with cholesterol reading. So if you're someone who struggles with high cholesterol, adding in more soy is a great healthy way to help lower your cholesterol levels. Ground flax, this has been shown to improve acne and hair scores. So especially if you have that stubborn chin hair, adding in some ground flax every day can help with the hirsutism. And then almonds and walnuts as they're a great source of healthy fats. So when I think about my sort of food pyramid or my food guide for PCOS, this is what we want to look at, right? So lots of fruits and vegetables and whole grains, our nuts, our legumes, fish and seafood, lean proteins, and then having things like red meat or sweets less often. So it's not about never eating them, but trying to have them less often. In terms of naturopathic care, now we are going to discuss some supplements and some other lifestyle interventions that have been shown in the literature to be beneficial for PCOS. As always, this does not mean that this is for everyone, but these are things that you can discuss personally with your healthcare provider to see if it makes sense for you to take them and what benefit you might expect. Exercise. Well, exercise, if there's one thing I'm going to prescribe, I'm going to start with that. There's a couple of reasons why. We know that exercise helps improve that insulin sensitivity, which can increase both ovulation and pregnancy rates. And exercise, as part of a healthy eating plan, can help with weight loss. And for certain individuals with larger bodies where weight loss might be indicated, even a small amount of weight loss, so 5 to 10%, can help restore ovulation. So if you're trying to get pregnant and struggling with anovulatory cycles, if weight loss is indicated for you, adding in some exercise is going to benefit your physical and mental health, but it's also going to help you get pregnant. One of the biggest myths I hear is that you can't do what we call HIIT workouts with PCOS, and this is simply not true. So high intensity interval workouts are actually very effective and they do not increase cortisol. When we actually look at the studies, HIIT workouts can actually lower cortisol, which is our stress hormone. And we want to keep our stress under control for overall better health, but especially if you're trying to get pregnant, we want to try and reduce that stress on our body and lower our cortisol levels. So you don't need to fear HIIT workouts. And the great thing is that doing a more vigorous exercise at home, it's quick, it's effective, you don't need a ton of equipment, and you don't need to go to a gym for it. So check, 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 it's all the boxes. So don't be afraid of vigorous exercise. And it's that real vigorous exercise when we're really getting our heart rate up, where we're going to see this beneficial change in our hormones and our ovulation rates. Keep in mind, use it or lose it. Consistency is key. So when starting out, maybe you haven't exercised before, that's okay. Start small. Maybe look at a couple days a week and work your way up. Maybe get a gym buddy, maybe get your partner involved and set some goals together. But we want to make sure that we're maintaining that exercise because then we can continue exercising during pregnancy as well. Myo-inositol. So myo-inositol is by far my number one prescription for PCOS, as it has the most evidence for supporting PCOS. And when I started practicing back in 2016, I had a lot of people go, I don't even know what inositol is. Now I have patients coming in and saying, oh, actually, my specialist recommended I go on inositol. So it's really come a long way in terms of the literature and the expected benefits. There are a couple forms of inositol in the market, but we do know that myo-inositol specifically, this isomer tends to be most effective, especially actually when we combine it with folic acid, we see additional benefits. Inositol is going to improve that insulin sensitivity. It also supports thyroid function, helps reduce rates of miscarriage, and also gestational diabetes in pregnancy. It's a safe and effective mechanism for inducing ovulation, and it can also improve egg quality and increase pregnancy rates when combined with fertility drugs. So if you're someone who has been taking something like a Clomid or a Letrozole to help with ovulation, we find that when we add in the myo-inositol, we have better egg quality, we have higher pregnancy rates, and we also have lower rates of miscarriage. This can be taken in either a pill or a powder form. So depending on if you want a powder or the convenience of a pill, there are numerous ways we can get myo-inositol in. Now we kind of think about inositol, what's next? Close second would be something called NAC or N-acetylcysteine. So NAC is a powerful antioxidant that helps regulate insulin levels and decrease testosterone. NAC is a precursor to something called glutathione, which is our master antioxidant in the liver. So by adding a NAC, we're helping with those detoxification pathways and helping increase the antioxidant load, which is also important for egg quality. When we combine it with clomidine letrozole, NAC helps increase not only the thickness of the uterine lining, but also the number of the follicles produced and the ovulation and pregnancy rates, which is pretty cool. It's also great to see that we have studies where we're combining supplements with medication. And while everyone's situation is different and you want to speak to your healthcare provider, it's great that we now have options where we can have supplements and medications working synergistically to help support you in a safe manner. One study actually compared NAC to metformin head to head. Now, metformin is technically a drug for diabetes, but it's also commonly used to help with PCOS management and also fertility. And what we found was that NAC was just as effective as metformin, which is great, but also had fewer side effects. And so, with helping with symptoms of PCOS, we can help balance the hormones using NAC, similar to metformin, but having less side effects because, as well as metformin is a great prescription option, it does often cause some GI distress. And so, if you're someone who's suffering with metformin, you could certainly talk to your provider about the benefits of NAC. Now, omega-3 fatty acids, this is a little bit of a supplement and a nutritional intervention as well. We know that higher intake of omega-3s, so these essential fatty acids, have been shown to boost egg quality and also support implantation of the embryo. Omega-3 fatty acids are sort of like a natural blood thinner. So they're going to help with blood flow to the uterus, helping support implantation, but also improving the quality of those eggs. As an aside, supplementation improves markers of cardiovascular disease and also helps lower triglycerides. High triglycerides are very common in PCOS because one of the main things that raises triglycerides is insulin resistance. And omega-3s have been shown to bring that triglycerides level down, which is what we want to have a protective effect on our cardiovascular system. Some of the best sources are going to be things like our fatty fish, so wild salmon, trout, sardines, and mackerel. And if you don't eat fish, we can look at food sources such as ground flaxseed, walnuts, or chia seeds. Now, vitamin D. Vitamin D deficiency is very common. As I mentioned earlier, it's even more common in PCOS than the general population. One thing that I'm a big stickler about is actually testing your vitamin D levels because I could have two women who are similar in age, lifestyle, and they could have completely different vitamin D levels due to genetics. So, how much vitamin D we give each patient is entirely dependent on their blood work. So, this is one that you want to test and not guess when it comes to your vitamin D levels. And I'm going to tell you why. So, in one study, live birth rates after ovulation induction were increased by 2% for every 1 nanogram increase in vitamin D concentration. So this is really interesting. So for each 1 point we increase someone's vitamin D levels, their actual live birth rates, which is what we care about most, also went up by 2%. So it's not just about vitamin D helping with fertility, but it's helping you bring home that baby. In another study, vitamin D levels that were below 50, so around 125 nanomoles, which is the Canadian units, double the risk of miscarriage. And if you're here in Canada, the normal range for vitamin D is actually 75 to 250. So for the general population, we want to see you between 75 to 250. But from a fertility and PCS perspective, we find that the optimal range is somewhere more between 110 to 125. So we're not just shooting for sufficient, but we're shooting for optimal. And this is why we want to test and not guess so that we can give you the appropriate amount of vitamin D. Lastly, acupuncture. So if you're able to access acupuncture where you live, this can be a great add-on to your current lifestyle regimen. Acupuncture can help with blood flow to the pelvic region, promoting relaxation and restoring ovulation. Helps promote ovulation by also helping balance hormone levels and reduce stress. My patients who do acupuncture report that they feel better, they sleep better, their digestion improves, their periods are less painful. So it has a lot of great benefits on the body, both mental and physical. Typically, we're performing it 1 to 2 times per week, and it is safe to perform during IVF and pregnancy. So, you want to work with someone who has experience in treating patients with PCOS, especially if you're pregnant, and look for a licensed acupuncturist or a registered naturopathic doctor who can perform the acupuncture safely. So, as I mentioned in the beginning, I also want you to gain confidence in this webinar around speaking to your provider. So, you can go to them and say, what are some potential causes of my current symptoms? We don't want to jump to conclusions that it's just PCOS. We want to rule out other things because it might be PCOS. As I say, it might also be an underlying thyroid disorder. So, depending on what are the causes of your symptoms, we might need to run some additional blood work. Do I need to receive any tests to check for potential causes? In certain cases, we might not need to run blood work, right? If it's pretty clear that your symptoms are being caused by XYZ, running additional blood work, if it's not going to change our treatment plan, isn't indicated. But if we're not sure, this is when blood work can be incredibly helpful. Maybe you're not interested in taking medications at this time, like letrozole and metformin. You want to ask your provider, what are my other options? Or you're not interested in trying fertility drugs. You'd rather try to conceive without medication. You can ask, does this even make sense for you? Why or why not? Right? If someone's providing you medication, we need to understand why they're prescribing it to you and what benefit you can expect. How long should I take the treatment to work? What if it doesn't work? For instance, we know with studies on inositol that it takes about 12 weeks or 3 months to see benefit, but we do see after that time a significant jump in some studies up to 80% of women resume cycling or resume ovulation, which is huge. That is a really, really great benefit, but we do need to stick with it for about 12 weeks. So making it be clear around what is the timeline of the expected benefit is important when speaking to your provider. What if I develop new or worsening symptoms? Best to speak to your provider then and let them know what's going on because we want to better understand, is this something unrelated to your supplements? Is this something that we started new? Are you having a side effect from the medication? So be clear on when you should reach out and what are the side effects that you should be watching out for. So that's everything I have for today. I want to thank you so much for spending your time with me. I know that your time is valuable. And for anyone out there struggling with PCOS, I hope this brings some clarity around your diagnosis and helps you feel confident in your day to day choices in managing your PCOS and feeling your best. As I said, I'm Dr. Laura Von Hagen, a naturopathic doctor here in Toronto. If you want to connect further with me, I'm at Higher Health Naturopathic Center up at Young and Lawrence. I also have my website and I'm also super active on social media. So make sure you give me a follow or reach out if you have any questions, and I would love to hear from you. Take care, everyone, and have a wonderful day.